This project is supported by the Administration for Community Living, ACL, U.S. Department of Health and Human Services, HHS, as part of a financial assistance award with 100% funding by the agencies. The contents are those of the authors and do not necessarily represent the official views of, nor an endorsement by, ACL, HHS, or the U.S. government.
Hello and welcome to Ask SMP. I'm Danae, your Community Outreach Specialist in Mississippi.
And I'm Janetta, Complex Issues Specialist for the Senior Medicare Patrol program in Georgia, Louisiana, Mississippi, and Vermont. Each month, we take a question from a beneficiary and break it down so you can learn how to protect, detect, and report Medicare fraud, errors, and abuse.
This month's question comes from Irene, who writes,
My husband recently had a fall at the grocery store, and someone called 911 to take him to the ER. In our small county, a private ambulance company responded. He was conscious, talking rationally, and other than a bruise on his knee, showed no serious trauma. He could stand and walk without assistance. They just transported him to the hospital where he was tested and screened. He was discharged 3 hours later, not seriously injured, and apparently no need for the extensive workup. Our Medicare Advantage plan was billed for ER services plus physician charges, which it did not pay. We were also billed an excessive amount by the ambulance company, also not covered. Why did this occur, and how can we avoid it in the future?
That's a common question, Irene, and it highlights an important issue. In most instances, emergency responders will address medical necessity at the scene and advise if ER destination is reasonable, given the level of trauma or illness. Private transport services may not always adhere to this. Additionally, calling for an ambulance when it's not an emergency and the patient could use other safe transport will likely result in a denial based on medical necessity.
ambulance fraud, errors, or abuse are common when ambulances are used for medically unneeded reasons if other forms of transportation can move the patient safely to the ER, doctor's office, or other appointments. Some common types include falsely billing for unprovided services, overcharging, upcoding, or overbilling to elevate reimbursement. Kickback schemes can also occur between the ambulance service and the hospital, where the ambulance agrees to transport low or no profit trips in exchange for the hospital exclusively using their service.
In your husband's case, there appeared to be no significant medical emergency. He could have been evaluated in an urgent care setting or even a physician's office. He could have been safely transported by private vehicle, as ambulance service was not medically necessary, nor was the extensive testing given an apparent lack of serious trauma that was deemed unnecessary by your plan.
Review your Medicare Summary Notice, MSN, or Explanation of Benefits, EOB, for denials and associated reasons. Medicare audits are random and directed toward the provider. The beneficiary is not liable, and a letter is sent explaining why. Under Advantage plans, you can appeal the denial, but know that obvious lack of medical necessity will not support your claim. Your State Health Insurance Information Program, SHIP, can assist you with the appeal process.
Medicare Part B and Advantage plans cover most medically necessary ambulance transportation, including 911 responders. There are conditions that must be met, such as destination to closest appropriate facilities, but the transport must be medically necessary. While 911 emergency calls to the closest hospital may be without charge as part of community services, private ambulance service is not.
Insurers determine medical necessity through comprehensive medical record review to determine if the services rendered are clinically appropriate in terms of type, frequency, extent, site, and duration, are considered effective for the patient's illness, injury, or disease, and are not more costly than an alternative service that produces similar results.
To avoid this in the future, consider if other safe transport is possible when it's not a true emergency, and review your statements carefully. If you suspect fraud, contact SMP.
Thanks for joining us on this episode of Ask SMP. Stay alert, stay informed, and protect your Medicare.
If you have a Medicare fraud or scam question for SMP, please email asksmp@smp@advisewell.org. You can also call the Senior Medicare Patrol at 1-877-272-8720 or visit www.stopmedicarefraud.org. Take care, and we'll see you next time.